of consumers and payers having a trust that this data is safe, it is private. And as that critical mass builds, the market sort of drives consumers to want their payers to supply a seamless integration across all of their medical records. So if I'm a consumer and I'm choosing my health plan, from insurance plan A and insurance plan B, I might choose the one that has a tighter integration with all of the other information that I have. And so in that way, you sort of build that cycle. As far as infrastructure, Microsoft, we pay close attention to this area in terms of our SDK, especially in the Health Vault space, and are really working with multiple ISV partners to develop the data models and transformations necessary to support incoming data in a variety of open standards that are out there. So I don't know if that answered your question, but I guess from an infrastructural sense, continuing to build up and to keep up with the ability for ISVs to build in and add to that ecosystem.
Any other questions? We have a question on that end. Thank you.
Yeah, this question's for Steve. I appreciate the consumer influence on the marketplace, and I'm looking forward to that. Could you be prophetic and forecast when you anticipate these capabilities are going to be available to all of us?
Oh, wow. I wish it was soon because, like I said, I've been dealing with this for 3 years on trying to make decisions without having the data. I think I see it accelerate every year. I see more and more tools out there. Our report is a prescription for 2015. 7 years away, it's going to come up before we know it. I think that we'll see a lot of that by then. Every year, when you see your health plan data come out from your company, you're seeing more shifts in that direction. Just this year, there were several more preventive care programs, several more rebates, several more incentives to take care of yourself. The dollars that IBM contributes to that health savings account went up. I talked to my colleagues in IBM. It's, well, I've got a big family, that's high deductible, I can't do that. The other thing IBM has done is to make sure that all preventive care is not part of my deductible. So, annual physicals, preventive, a number of preventive things that I do every year are all I don't worry about. I just go do them. So it's not something I have to think about. Well, I've got to shop for that. So I just go to my primary care doctor and take care of that. But as far as a prediction on when it's going to happen, I would think in the next 10 years we're going to see a big change because the companies just are not going to continue to pay the dollars that they're paying now. They can't. It's not sustainable. It goes up every year, so more's got to be done there.
Any other questions? In the back. Thank you.
This is sort of a continuation to the question before, and it addresses Sonia and Steve again. What I'd like to point out is that in the early 90s, there was a study commissioned by DARPA to MIT. The result of that study was called the Guardian Angel product, and it was essentially Guardian Angel project. Yes, it tanked. But to this day, it contains all the ideas that we're talking about in terms of ubiquitous health, in terms of electronic medical records. Now, by legislature, we introduce electronic medical records into hospitals. God knows when it will move into the doctor's office. What I'm getting at is during the same time span, we traveled from IBM 486 and Windows 3.1 to where we are today. So there must have been an incentive for IBM and Microsoft to get on this journey. What kept you in terms of healthcare. Why hasn't it happened, if I may ask? There must be something that we the consumers and the scientific community and so forth do not understand about the process that the giants of technology use to advance technology. It has not happened in healthcare, so if I may ask the question.
Are you asking why haven't the applications to do this been developed before now?
Why nothing has been developed? Why did it have to be, for example, an EMR had to be legislated in order to start being? Where is the missing link?
Yeah, I think it goes back to what I was saying before in the industry's transition from a status of, cost plus to realizing they had to compete and had to work in a new marketplace. And it's, I think Dr. Guillaume showed earlier that, healthcare spending on IT has been very low. And, there's a lot of reasons for that. I mean, just the laborious nature of healthcare requires the capital to be devoted to that. Even in today's technology age and the things we're talking about, that technology spending still isn't increasing to where it should be, because hospitals, especially here in Florida with the aging population, they're building facilities like crazy, billions of dollars in projects. In Orlando, I think it's amazing how much money is being spent on new facilities. So that's where the capital dollars are going. They're still trying to improve the basics, and the IT seems like an extra. So it's not that I think IBM has been supportive and really trying to push to, and same thing with Microsoft, push people to use technology and automate. It's that their focus in healthcare has not been there. It's been on just taking care of the patient and dealing with the managed care programs and things that they've had to deal with.
I think it's time for, I'm sorry, Sonia, go ahead. Coffee can wait.
I was just going to say, I would absolutely agree with that. I mean, it's really about the incentives. And, the incentives to use technology and the incentives for changes in healthcare, those things kind of have to go hand in hand. And, eventually you get to sort of that point, that tipping point. You can kind of make the analogy with online credit card purchases. People were very distrustful and didn't want to do that even, 5 or 6 years ago. And now it's a very standard thing. And that's because, many technology companies were incentivized to actually provide that service for people. And so I think, if you think about kind of the payor and the kind of the industry incentives that Steve brought up, those really have to change kind of hand in hand. And by kind of putting the underpinnings of the infrastructure there, you sort of you begin to bootstrap, and that's kind of what our approach has been in the health vault and the Amalga space.
I think it is now time officially for a coffee or tea break. Thank you, Sonia, Lewis, and Steve.
Thank you.
Thank you.